Hello and welcome everyone to today's interview. I'm Nikolas from WhatClinic.com, one of the largest online medical directories in the world for elective care. I'm excited to virtually travel the world by inviting and talking with doctors from every country who are using WhatClinic to reach international and local patients. So, today we are traveling to Turkey and the city of Fethiye. Let's welcome Dr. Baris Yigit. He is a plastic surgeon, member of the Turkish Society of Plastic, Reconstructive and Aesthetic Surgery, Turkish Reconstructive Microsurgical Society and International Society of Lymphology, and also the owner of the Baris Yigit Plastic Surgery Clinic in Fethiye. Welcome, doctor.
Hey, Nikolas, how are you?
I'm fine. How about you? We're excited to have you here.
Thank you very much. Thank you very much. That's really good introducing me. And as we told before, so we are based in Fethiye, and Fethiye is now 16 degrees Celsius outside. I just want to say everybody that so even in winter we have really good season.
This is very important, especially for medical tourists.
Yes, we will talk about it hopefully.
Patients.
Yes.
Yeah.
Yes.
So could you tell us more about you, about your studies, your specializations?
Okay, of course. So I was born in 1979 in Antakya, which is the southeast part of Turkey. And I completed my primary, secondary, and high school everywhere in Antakya. And then on 96, I started my medical faculty in Ege University, which is located in Izmir in the west part of Turkey. And then I completed like around 2003. And when I was completing my medical school, I went to United States to conduct a research on some scientific things. And 6 months I stayed there and then came back and finished my faculty. And then I started on 2004 to aesthetic, plastic and reconstructive surgery residency in Istanbul. So the biggest university in Turkey is like an Istanbul University, Istanbul Medical Faculty. I finished my residency there on 2010. And then, so we have some regulations in Turkey. That's why after finishing your residency, you need to go to do your governmental due. And I went to east part of Turkey and I did my due there for 4 years and then went back to again the west part of Turkey, and I was serving as a chief of department in plastic reconstructive surgery in Düzce University, and I had many published scientific articles there in many national or international scientific journals. And after that, I stopped my academic career actually, and I came back to Fethiye, which is the, I think, best place that I have ever been in Turkey, my all around. And I opened my clinic in 2019, and we are serving as a Baris Yigit clinic in Fethiye.
That's great. You have a long history of studies and experience. This is amazing.
Yes.
So in 2019, in March, you opened your plastic surgery clinic in Fethiye.
Yes.
What treatments can patients find in your clinic?
So actually, we do perform over 30 surgeries or 30 procedures in our clinic. So, you know, some of them are surgical procedures and the others like non-surgical. But to be in mind, patient care and safety are our top priority. So that is how our patients benefit from a process of continuous improvement in quality and the experience in our clinic. So our main policy to be on our patient sites. That's why we always says each patient is unique for us, but almost all surgical procedures and almost all non-surgical procedures can be done in our clinic.
That's great. And I really love your approach about what you said, that every patient is unique and has their own needs. So apart from local patients, you are working with international patients as well, right?
Yes, actually, it's been like around 1 year. We're just working on health tourism So our patients are from abroad and mainly from United Kingdom. And I can easily say like around, we just made the statistics like last week, and 91% of our patients are international and mainly coming from United Kingdom. But we have from Germany, and at the same time, we have some Romanian patients coming us, and we are going to start to Ukraine, I think in 2 months or something, but mainly from United Kingdom.
So you're mostly working with international patients. I mean, 91% is, it's a huge percentage. So these international patients, what are they choosing as a procedure? What is the most popular procedure for international patients?
Okay, so actually there are many popular procedures in the world now for the plastic surgery. If you're talking about aesthetic surgery, there are many. But what I believe is a surgeon has to focus on something. It shouldn't be like just one thing, but something. Not all the things has to be like done really in good way or something. That's why I am focusing on the body reshaping surgeries. And our main concern is like in body reshaping surgeries. That's why since our focus on that, our patients are coming for that. And our main surgery is like a mummy makeover surgery. You know, the mummy makeover is, it's been like 3 years. It's so popular, especially for the European mothers, I can easily say. And at the same time, after massive weight loss, we do like 360 lower body lifting. And at the same time, the body contouring as well. And the part of that body contouring is in liposuction. That's why we have 2 really good systems, which is the utmost technology and the Wazer and PAL. I don't have to say, I think, about Wazer or PAL something, because everybody knows if they are looking for a liposuction, they can easily find what it is or what not. And so we can easily do HD liposuction conjuncted with our body reshaping and body contouring surgeries.
So as I understand, patients have many choices of plastic surgery in your clinic. You're offering a huge assortment of treatments.
Yes.
So what are the benefits of traveling to Turkey, and especially your clinic, from their country to Turkey to have the procedure?
Yes, that I think it's really good questions, because that questions was standing in front of us, like when I started to do the health tourism, because I said, yes, of course, we're going to mainly based on United Kingdom, but how we can convince the people that they can come for 4 or 5 hours fly from their country to come here to have the surgery or to have the treatment. So, so you can get a procedure scheduled in our clinic as early as like around 2 to 3 weeks, compared to waiting for almost a year or more than a year for some procedures, especially in United Kingdom. So at the same time, our second advantage is like if you compare the prices between United Kingdom or all the European countries, our cost is really lower. And that doesn't mean, sometimes people ask like, why you are giving us less price? That doesn't mean we don't offer quality. Our work environment is like costing us in low cost and prices. That's why our prices is lower cost. And besides the quality and the availability of medical treatments, you get to experience a unique vacation in here. So when we start to do the health tourism, we started to promote our motto, which is turn your treatment into a vacation in Fethiye. So that motto is our main pivot point for this kind of treatments, because as I told you in the first of the conversation, today, even like in 26th of November, and I see outside and it's sunny.
It's really bright.
I told you it's 16, yes, it's 16 degrees. I can show it to you outside. Yes, as you see, it's so bright. And at the same time, and I have my clinic is just has a view on seaside view. And
that's
because
amazing.
Fethiye, yes, Fethiye is a harbor city, small, beautiful harbor city. And we always say quality and uniqueness and everything is in the best manner, and turn your treatment into a vacation in Fethiye.
That's awesome. So I keep 4 benefits for your clinic. As you said, it's the availability. Patients can book and have the treatment really fast compared to the UK. It's cost effective, great quality, and also a great place for vacations, as we can see there.
Yes.
Perfect.
May I say something that's just here? Because as I told you before, we have many patients are coming from United Kingdom. For example, if our patient is a lady, her husband is getting really good times in Fethiye, or vice versa, or some friends. Even we offer them, you can come with your company, with your 3 companies, 4 companies, it doesn't matter, and they can enjoy the Fethiye by you are having your really good treatment.
So talking about vacations, how many days on average patients need to stay in Turkey when they're coming for a procedure?
Yes, that is another good question. And so, of course, it depends on the procedure. So as I told you before, we are doing like mainly the body job, means like in breast and tummies and liposuctions and lower body lift, which like in body reshaping, recontouring. And that needs to be staying at least like 10 days here. Why? Because since it's going to be too much scar, and I need to see their scars, and I need to observe them when they out of the hospital. That's why 10 days for this kind of big packages is good. But if the procedure is like a best simple rhinoplasty, and like 6 days, 7 days is also enough. And or like just like a high definition liposuction, again, 5, 6, 7 days is enough. But as I told you before, every patient has uniqueness about the thing. That's why I'm telling you. So when I say like 7 days, that doesn't mean everybody will fit that 7 days. Sometimes it could be 5, sometimes it could be 9, but average I can say between 7 to 10 days.
Do your packages include accommodation as well? Do you offer them a full package?
Yes, of course, we offer them. So I don't want to struggle the patient in this one option or something. We always offer options and they can pick what they want. So one of them is including everything besides just the flight. Okay, so including the transportation, starting from airport to internal transportation for everything, and at the same time the accommodation and also surgery.
That's perfect.
Or they can say like they have a friend here, they will stay with them, and we can exclude the accommodation or we can exclude the transport or something like that. But we do have the package.
That's great, because patients want to feel that someone is taking care of them, and it's easy to do it. So that's great. Your focus on patients is amazing. So how international patients discover you, and how WhatClinic may help you on this?
Okay. So actually, since we talked to you about this thing, and so we are based in Fethiye, like let's say from London, 4 hours flight. So how we can reach the people? Of course, nowadays the best thing to reach is a social media. So we are trying to reach our patients by all means, such as social media, advertising in social media, and mainly with recommendations of our satisfied and pleased patients. So at the same time, WhatClinic helps us for announcing the voice of our pleased patients as reviews and providing leads to us to reach them directly. Actually, WhatClinic can do more if they put forward the specialization of each member by keeping close contact with them and following their return rates from the leads. This is what I think.
This is a great recommendation, and I will pass it to our developing team for sure. Thank you very much for this.
Yes, you're welcome.
So we're living in a world of social media and internet, and internet is a very important place to have your research and decide if you're going to trust a doctor and the clinic.
Yes.
So what do you think it's uh, important for international patients when they are searching online for a clinic? What can make them trust you when they're searching online?
Yes, that is main thing for the patients to choose their treatment clinic or something. So that's why I always say to my all clients when they come from abroad, I say they will reach somebody at the end of the line. They will receive proper information about me and treatment, what they want, and exactly the true before and after pictures, videos, and reviews when they ask us.
That's important. So people are asking for before and after photos, right?
Yes,
This is
they
something
ask.
important for them. They want to see the results of previous patients.
Yes, that's why I always say to all my patients, please be careful about that before and after pictures. You know, even in my clinic, I have many photographer and many photoshopper, many videographer, because we do all the things to advertise.
Yeah.
And that's easy to Photoshop the picture before and after. That's why it needs to be natural. It needs to be true. That's why I just say to all my clients, even the people who will listen, who will watch this conversation between you and me, they need to search about reviews of the surgeon at the same time. It's not just like before and after pictures.
Exactly. And this is why we are spending a lot of time on reviews here in WhatClinic, and we are moderating each one of them to make sure they're real, genuine, and the patient had an original experience with the clinic.
Yes, yes.
And one more question I would like to ask you is, what concerns international patients? What are they afraid before they take the decision to book their tickets and travel? Not to Turkey, but in general. Are they afraid of the language, let's say?
So I can easily answer this in this time of frame is COVID. Yes. Yeah. So there are many potential clients. They ask to my personal assistants who they talk to our potential clients, and all of them are concerning about the COVID. Of course, everybody in the world like concerning about the COVID. But we can easily say them, of course, in every countries, the numbers are getting higher, but we need to learn how to live with COVID. That's why we just always say to them, please take care of yourself when you come here, and we're going to do all precautions that has to be done for you. And at the same time, they ask about the language as well. The same thing. They say like, do you offer translators when I'm going to be around and when I'm going to go to the hospitals or something like that? And at the same time, they ask to my personal assistant, is the surgeon is speaking fluently English? Yeah. And these are mainly concerns of our clients. And at the same time, they want to trust you. That's why the communication between my personal assistants and the clients are so important. And I always say to my clients, please, if I have time, because I'm working so hard, so busy, but please find my spare time, even if it could be like 5-10 minutes, and arrange a video call with the clients, potential clients, and they can easily see me, and then they can see how I am, and then they can feel my body language. I think those are the important things to be done.
And reassure them that they can communicate with you and you can understand them, you speak proper English, and this is very important, especially for your target group, which is your largest target group, which is the UK citizens. So talking about COVID, how do you handle this situation now? What are the procedures that help you ensure that patients and your medical staff will stay safe?
Okay. So, of course, as I told you, COVID-19 affected our business as any other sector. So, since I mentioned earlier, safety of our patients is our top priority. So we do antibody tests when they reach here. So we don't want to force them to have the PCR test, which is taken from the nose, you know. And I've been done that like around 10 times for precautions for everything, and it's really annoying. That's why we took some special and reliable tests, just antibody test from your tip of your finger, just one drop of blood. And when they arrive to clinic, they will have that test, and we will see did they face up with coronavirus or not, because it will show us the IgM and IgG levels. So for example, with that, we catch up a COVID-19 patient in our clinic, and we sent her to get her treatment, and she stayed here for 15 days in quarantine, and she was okay. And then we performed her surgery, and we sent back to her country, which is, it was like, I think, Scotland. Anyway, so that's why for all precautions for the patient side, we do our antibody test, and it shows the most reliable result for us. At the same time, we do that antibody test in every week to all my clinic staff. We search them, we follow them. Of course, we are sharing time here together. We are like 12 in my clinic, all my nurses, secretaries, and everybody. And when we are together, we need to not share to each other. And in our clinic, we always have masks, even if we are talking to each other. And at the same time, all the staff are having their lunch in different areas of clinic. And at the same time, as I told you, every week we make antibody tests to all clinic staff.
That's great. I think you're setting a great example for every other doctor and clinics on how to take care of your patients and medical staff during these hard times. So let's go to a subject that you mentioned earlier, social media. I saw your YouTube channel, and it's amazing. I was really impressed, and I learned many things about how procedures are done. You know, I knew, for example, about thread lift, but I saw it on the video, and it was really, really interesting. So, concerning social media, what has worked for you, and what would you suggest to others on how to handle social media to get more patients and also build trust with patients?
Okay, so there is a fact that everybody has to know that. So, for example, if I am a potential client and I am thinking about liposuction, do you say, and when I am spending time on Instagram or on social media in anyone, and if I see something that gives me some clues about what I am thinking to have in future or now, it doesn't matter, has to be trustful. So that's why we always divide our YouTube videos, as you mentioned me, with YouTube videos to 3. One of them has to be information video. So I am just like sitting on the chair and I'm giving the best updated information about the procedure. And the second one is question and answers, because when we have the clients here or when they ask us via any social media or internet, it doesn't matter, we always save those questions to answer them. And we do another type of video, question and answers videos. Those questions are getting from all our clients. They are true and real questions. That's why the answers of them are really good. As you see in all big city, internet websites, it says like frequently asked questions. It's the same thing. And the third one is procedure videos that we are doing, we are producing. So it shows how we do the procedure, and during the procedure, I can talk to the camera and I can say the trick and the thing about that procedure, what a patient has to think about this, or if they can easily understand whether they are suitable for them or not.
Yeah, exactly.
And yes, social media in general is really significant about that and allows for immediate interaction and patient feedback. That's why we can also respond to our patients right away, and it increases the awareness about health issues. We also get more informed about our patients at the end of the line. So information is reciprocal. So if an existing patient has something to say about our clinic and services, chances are high they will share their opinion with their friends and followers on social media. That's why I recommend to all my colleagues or to all my doctors in this area or something like that. The social media has to be using really in good manner and trustful manner.
Exactly. In order to also provide useful information to patients and show them what to expect. So I see that you're focusing so much on patient, and this is really important, and it reflects on your service score on WhatClinic. And service score is an indication of what patients can expect from a clinic in terms of care. So your service score at this time that we're having the interview is 10 out of 10. And it's one of the highest we have in our website. And congratulations for this.
Thank you. Thank you.
What do you think? What would you say it's the most important factor to achieve a high score in patient care in such an index as the service score?
Okay. First of all, thank you that we got that 10 out of 10. So actually we worked for that because our another motto is, as I told you, each patient is unique for us, and all of them has to be pleased at least what they want on day what they want. Experience of the surgeon and professionalism are important factors in this area. So following up new technology is another significant element. So expectations and the medical necessity should be met in the middle. So spend time with your patients, try to understand their expectations fully. That is so important. As I told you, each patient is unique. You need to understand what they are expecting. So if you understand what they expect, and if you can understand them, what you can offer them, what you can do them, if they meet each other, the patient will be happy, which is we are doing in all times. It's been like 16 years I am performing surgeries in plastic surgery, and I'm always doing this. And that's why I think we have that 10 points from our patients.
So focus on the patient, spend time with them to understand their expectations. And tell them honestly what you can do for them.
Yes.
That's great.
Sometimes, Nikolas, sometimes even they want, for example, tummy tuck from us. They send their pictures before they come here. They send their pictures. And I say to my personal assistant, when I see the picture, I say like, she's not suitable for tummy tuck. But she has been informed from some clinics that she was suitable for that. And we always say the truth. Of course, the money is important for everybody. We need to gain our money to survive or something. But at the end of the day, if the patient is not happy, I will be not happy. That's why I need to focus on the good job. And good job has to meet the expectations and the things that we can already do for them.
I understand. And honesty is very important when you're having patients, and they trust their health in your hands.
Yes.
So thank you very much for this interesting interview, Dr. Baris. For everyone who is interested in contacting Dr. Baris for more information about any procedure, you will find all the links in the description of the video. And I highly recommend to check Dr. Baris' YouTube channel, which is amazing. And don't forget to subscribe to WhatClinic social media, YouTube channel, and also Dr. Baris' YouTube channel. Thank you very much for this wonderful conversation, Doctor. I wish you all the best.
Nikolas, for the next time, hopefully we're going to host you here in really
I really want to come, really.
We can do our conversation here, and we can have you here for 2 days, and you will be so amazed.
Thank you very much for everything, Doctor. Hope to see you soon.
You're welcome, Nikolas. Bye-bye.